Thank you, Claudia. I'm going to be speaking with Jade Glenn with Ridgecrest Regional Hospital. Jade, can you tell us a little bit about Ridgecrest Hospital and share what your role has been during the pandemic?
Hi, Mike, and hi, everybody. Thank you for inviting me here today. So I represent Ridgecrest Regional Hospital, which is a nonprofit acute care facility out in the high desert in the Indian Wells Valley. We're a very rural community, and a large part of our town is actually supporting the China Lake base, which is here. We have around 1,000 employees at Ridgecrest Regional. We're a 196 bed facility, which includes 25 inpatient and 99 skilled nursing facility beds. And so I am actually the marketing and communications director for the hospital. And since the 2019 earthquakes, I've also served as the public information officer here. So yeah, it's been a bit of a roller coaster ride since 2019, having those two huge earthquakes, and then straight off of the back of that going into the pandemic. So it's been a busy time for sure. My responsibilities during the pandemic have been really just to keep everyone updated, keeping the staff informed and the community. Like I mentioned, we're in quite a unique location out here in the desert. We're quite a rural and isolated community, and although we kind of fall under Kern County Public Health and all of their information, a lot of our members of this local community really look to us directly for healthcare information and advice. So we've just really been trying to stay on top of that and putting out as much information as possible to the community.
Well, I can attest. I think you've been doing a great job with that. How many ICU beds are at Ridgecrest Regional Hospital, and how has the recent surge impacted the availability of those beds?
So we actually have 4 ICU beds here at Ridgecrest Regional. They can be expanded to 8 and then again to 16 if needed. At this current time, we're seeing, we actually saw a slight decline in the last 2 weeks. We've currently been reporting every 2 weeks, every 14 days, our testing and results to the community. We're at about a 6.9% positivity rate at the moment for the last 14 days. And that has gone down slightly to 2.4% from the previous update. So that's some good news there. But
what percentage of COVID patients are you seeing that are unvaccinated?
So currently, we're seeing about 87.2% unvaccinated from the RRH test that we've done. In the same period of time, though, we have seen an increase in vaccinations, which we're kind of seeing, a decline there in the positive cases and vaccinations going up slightly. So that's quite encouraging, and we just hope that the community continues with that trend.
Are you aware of any specific numbers related to the Delta variant versus the MU variant?
No, we actually don't receive that information here at the hospital. The routine testing that we do for COVID-19, it doesn't tell us what type of variant strain someone has tested positive for. The strains and the variants are actually managed by the public health department, and they would identify those variants through a genetic sequencing process. And we don't actually receive that data. I know the county is reporting that on their dashboard that they publish which variants they've identified in the county and the numbers for each of those.
Is your facility still doing elective surgeries?
We actually are, yes. We haven't. We haven't cancelled any since it was the very start of the pandemic that we had to put a pause on them for a brief moment. But since we started them back up again in 2020, we haven't had to postpone any since then. In the event that we do have to, we would activate our emergency response plan, and all of the elective cases would then be cancelled. So that would include non-emergency diagnostic testing and non-emergent surgeries. And we'd also then just focus on those entirely needing our immediate attention in the hospital and the emergency room, pooling all of our resources to where needed most. I think it's kind of important, sorry, at that point, just to add in that which we just really want to focus on serving all of our community's healthcare needs. We did notice during the pandemic that some of the community members were not, there was kind of this fear of coming into the hospital and maybe kind of ignoring certain other healthcare issues through fear of, COVID or coming into the hospital at that time. But we really just don't want people to overlook those underlying conditions. And we're trying to really attend to as much as we can so that we don't see those underlying conditions being overlooked and seeing further problems down the line.
How are the hospitals, nurses, doctors, and other staff holding up through this pandemic?
Yeah, I think everyone's suffering a sense of fatigue right now. It's certainly been tough on our workers. They've continued to work through the 18 months of this pandemic with chronic staff shortages, and they really are exhausted at this time. I know many of them are discouraged by low vaccination rates in the community, and that means our hospital and ICU are at risk of filling up again with patients suffering and potentially dying from preventable illnesses. So yeah, it's been tough. However, we do really want to commend this group of dedicated people for their incredible commitment to protecting our patients' health. We've tried to, do little events and thank you celebrations. We have an active employee engagement committee here at Ridgecrest Regional Hospital. We've organized lunches and giveaways and gifts and kind of just little things that will try and lift their spirits during these times. So we kind of hope that helps, but we know it has been tough for them.
How is this surge different than a year ago, and what do you see as a challenge around this time?
I think the main difference this year is obviously we didn't have a vaccine last year. This year we do, and the holiday season is coming up, and that's when we saw our COVID cases really spike last year. I remember everything kind of just shut back down again around October, November time after all of those holidays, and then going into Christmas, it was pretty rough that time last year. So this year we're hoping that with the vaccine, that more people will be getting vaccinated, we'll be able to prevent some of these unnecessary hospitalizations and deaths. We also now have better treatments available. So, with the monoclonal antibody therapy and prophylaxis and different treatments like that, that we have more options and we're able to help our patients better at this point in time. Yeah, I think that's the main difference we're kind of seeing currently.
Okay. What would your message be to the community about the COVID-19 virus?
I think it's pretty clear at this point. I think the main message at this point really needs to be, if you're not vaccinated, you're still thinking about it, just please get vaccinated. I think if you have questions, concerns about the vaccine, please talk to your doctor about it, or your healthcare provider, and then just really continue to follow the guidance from our public health officials and experts, the masking guidance that's been in place. Be cautious of those large gatherings, especially again, like I mentioned, heading into the holiday season, and really just pay close attention to your own symptoms. If you notice any, just go and get tested early, because the early identification will help prevent the spread. So that's, yeah, I think it's just, please go get vaccinated. And here in Ridgecrest, we actually, at our urgent care clinic, we're now offering walk-ins, so no appointments needed. You can walk in 7 days a week to get your vaccine, and all of our other RRH clinics, you can ask for the vaccine there and then in the clinic at your appointment. I know our staff will be happy to assist.
Fantastic. We'll give our best to all the healthcare workers there. Next up, we have Carla Gard from Bakersfield College.